Okay. Good morning, everyone. Thank you again for joining us. My name is Brooke Oliveri. I am the manager of the Long Island Health Collaborative. For those of you who may not know, the Long Island Health Collaborative is a group of 300 plus hospitals, county health departments, and community-based organizations, all working toward improving the health of Long Islanders. Some housekeeping before we get started. Today's program is being recorded. We will have some pre and post event poll questions for you to answer today. So please stick around for a robust Q&A and those poll questions after Dr. Guerrier's presentation. Many thanks to AARP, our sponsor. We are so thrilled to have them on board with this event series. And I was going to turn it over to Ron Rowell, an AARP volunteer, to say a few words about the organization. I don't see him here, so I think I'm going to say a few words about AARP. So on behalf of AARP,
It hasn't started yet.
Okay. On behalf of AARP, welcome to today's Talk with a Doc webinar. We're committed to helping you stay healthy and stay connected, so we congratulate you for taking the time to learn more with AARP and the Long Island Health Collaborative. AARP is a nonprofit, nonpartisan membership organization for people aged 50 and older. There are 38 million members nationally, approximately 2.5 million in New York State, and about 500,000 living on Long Island. AARP works to strengthen age-friendly communities and make for happier, healthier residents of all ages. And we advocate for what matters most to people 50 and over and their families, with a focus on health security, financial stability, and personal fulfillment. So you can learn more about other online classes, events, local discounts, volunteer opportunities, and more at aarp.org/nearyou. And once again, that's aarp.org/nearyou. All right, and once again, thank you to AARP for sponsoring this event. So before we get started, as I mentioned, we do have some poll questions for you to answer. So I'm going to launch those now. We just want to get your feedback on some things regarding chronic disease, walking, and your impressions about today's topic. So if you would please take a moment to answer these brief questions, we would really appreciate it. I'll just give it another minute here so everyone has time to read and answer the questions. I see a lot of answers popping up. Thank you to everyone who's answering. Okay, we're coming up on 1 minute and 30 seconds here. I have 16 out of 19 participated, so I'm just going to give it one more second and then we'll close the poll and move on. Okay. Well, thank you so much to everyone who answered. We really appreciate your feedback. So now I would like to introduce Dr. Keasha Guerrier. So Dr. Guerrier, she's a board certified family physician, currently working as a hospitalist here on Long Island. She is also trained in disaster medicine and global health. She served as the chief medical officer in Puerto Rico after the devastation of Hurricane Maria in 2017. She has provided care to patients in Brooklyn, Nassau, and Suffolk counties since I believe it's 2012. She sits on the board of directors for the American Academy of Family Physicians, and she is committed to the health of the patients that she serves. And she is a wonderful friend of the Long Island Health Collaborative. She is always ready and willing to participate in community events like this one. So we are super excited to have her here. And without further ado, I will hand it over to Dr. Guerrier.
Thank you so much, Brooke. So good morning to everyone. I prepared one slide. I am going to speak off of a different presentation, but definitely want to leave a lot of time for question and answer. So I want to talk today about diabetes, what it is, what causes it, why excess sugar is harmful in the body, which organs it primarily affects, what an A1C is, if anyone has heard that term, how to manage diabetes, and how to prevent diabetes, which I think is one of the most important things. So when we talk about diabetes, so what is diabetes? A term that I'm sure a lot of people on the call have heard. So diabetes is a chronic condition, so it's a long-lasting health condition that affects how your body turns food into energy, or how your body processes the sugars that come from the foods that you eat. So most of the foods that you eat are broken down into sugar, which is also called glucose, and it's released into your bloodstream. When your blood sugar goes up, it signals to organ in your body called the pancreas to release insulin. And what insulin does, it acts like a key to allow the blood sugar that's in the blood to enter the body's cell. So why is that important? Because at the end of the day, our bodies run on sugar optimally. Your brain runs on glucose, which is sugar. The heart, your muscles, all of your organs, all of your metabolic functions run on sugar. So we need sugar in the body, but we need a certain amount. And we need insulin to allow the sugar that's in the blood to enter each cell. So what causes diabetes mellitus? Diabetes mellitus, which is also called type 2 diabetes, it's what most people know as kind of diabetes that you get once you get older, because there's type 1, there's type 2, there's also something called bronze diabetes, which is another metabolic dysfunction. But type 1 and type 2 diabetes are insufficiency or malfunctioning of the pancreas. Type 1 diabetes happens to people who are younger, early onset. Type 2 diabetes is a later onset. It is linked to a lot of things. So it's linked to obesity. It's linked to excess sugar intake. It's linked to eating unhealthy foods. It can be linked to certain medicines like long and sustained use of steroids, whether those are steroids like prednisone for a chronic lung condition or other. It's also linked to a sedentary lifestyle. So people who are not active, people who are not out walking. There's an increased risk of diabetes with age. Stress can cause diabetes, which people sometimes are surprised when they hear, well, how does stress cause diabetes? It's because when you're stressed, you have increase in a hormone called cortisol, and cortisol decreases insulin sensitivity in the body. You could also have a genetic predisposition to diabetes as well. But in the United States, diabetes, heart disease are the two highest number of chronic conditions. And diabetes in the United States, especially in developed countries, is mostly linked to obesity, sedentary lifestyle, and unhealthy eating habits. So why is excess sugar or glucose harmful? So I'm going to take 2 minutes to teach everyone a little bit about biochemistry. So after this, you can say, I know biochemistry and I'm good. All right. So essentially, and I'm just going to use my hands for this, the molecule of sugar, right? So when we look under a microscope and we look at what the chemical composition of sugar and what the molecule looks like, it looks like this. Everyone can see my hands. And if you can imagine that my fingers that are sticking up are sharp, spiky edges, right? And so to visualize this more, has anyone ever had sugar scrub? You can raise your hand on the screen or nod if I can see you. A sugar scrub where they take just regular brown sugar, yep, and they will mix it with maybe some olive oil or whatever it is, and then they scrub your hands or scrub your feet. The sugar molecules or the sugar granules are sharp, they're caustic. They're the things that scrub your skin, right? So I want you to imagine that excess sugar in the blood is like a sugar scrub on the inside, because each molecule of sugar is spiky and it's sharp and it's coarse. So what happens is in diabetes, why it's harmful, all of that excess sugar is in the blood vessel, and it's sharp, and it's scratching blood vessels and causing damage. And think about which organs in your body have received blood and have blood vessels. That's every single organ in the body, right? So we're talking about coarse molecules of glucose in the vessels of the kidney, and the vessels that supply blood to the eye, and the vessels that supply blood to the nerves, and the vessels that supply blood to the skin. So when we talk about what organs diabetes affects, it's every organ in the body. But the organs that are more sensitive to damage are the ones that I just talked about. So if we're talking about the blood vessels that supply blood to the nerves that have excess amounts of glucose or sugar, and they're being damaged by that sugar, then it suffices to say that people with diabetes that's not controlled have bad nerve damage. And they do. And that's something called neuropathy. So sometimes folks with diabetes will say, well, doc, my feet feel like they're burning, or I feel like I have a tingling sensation, or I'm losing sensation in my feet. I feel tingling in my hands. And that's the nerve damage that's due to that excess sugar in the vessel that supplies blood to the nerve. Some people with diabetes come in, and when we do their lab work, we see, their kidney function is decreased. Their body is not able to excrete the wastes from the kidneys the way it should. Well, why is that? Because those same blood vessels that supply blood to the kidneys, and the kidney's job is also to filter blood, the kidney is being damaged day in and day out. There are people with diabetes that have vision loss or cataracts or retinopathies, which are problems with their retina. Why is that? Because the blood, it has excess sugar in it, and it's supplying blood to the retina and to the eye, causing damage. So I say, to answer the question, which organs do diabetes affect? It affects the entire body. It affects the skin, it affects the eyes, it affects the pancreas, the kidneys, it affects the heart. Studies have shown that people with longstanding diabetes have a much higher risk for heart disease. The reason why, is because I spoke a little bit about this sugar scrub, let's call it, right? Coursing through the blood because there's high sugar. Our bodies do heal. I say that to say, if I were to cut my hand, I would bleed, but then I would get a scab, right? Which is deposition of little proteins called platelets. Platelets, part of that composition, they're made of fat, right? So the body puts down a layer of platelets to seal up the blood, to seal up the scar, to seal up the scratch. That same thing happens on the inside of our bodies. So as sugar molecules are going around and they're scratching the inside of our vessels, the body will put down a layer of fat to seal up that scratch. And that fat can be cholesterol or it can be LDL. So most times when I see patients that have high diabetic numbers, they also have high lipid numbers. It goes hand in hand. And those high cholesterol and lipid numbers affect the heart. They can clog arteries, cause heart attacks. So diabetes, for me, if someone asks me, well, which disease are you most concerned about? The answer has and still continues to be diabetes. Because it does affect every single organ and put people at risk for serious complications for their health. And it's reversible, but we're going to talk about that later on in the slide. So next question that I have here is, what is an A1C? Raise of hands, does anybody know what an A1C is? Okay, I'm just going to scroll down. All right, so the A1C is the, thank you, Beverly, and thank you, Mildred Vega. Perfect. So the A1C is a 3-month picture of what your glucose, or how much sugar you've had in your body. To do a finger stick and to look at that glucose, that number should be somewhere above 60, below 100, or below 90. That's normal. Anything above 90 is what we call hyper or high glucose. The A1C gives us a 3-month picture of what your sugars have been. So people say, well, why is it 3 months? We look at red blood cells because we said red blood cells carry glucose around in the body. So if we can capture a number of red blood cells, we can take an average of how much sugar are they laden with, how much sugar is sticking to them. The normal number for an A1C should be less than 5.7. So this is not the actual interpretation of it, but for the purposes of this talk, let's say 5.7% of each red blood cell should have sugar on it. Anything above 5.7% is too high. Anything above 5.7% means this person has diabetes, is developing diabetes, and is at risk for diabetes. And it's a 3-month snapshot because red blood cells only last in our system for 3 months, which is why if you've ever been diagnosed with pre-diabetes or diabetes, your doctor will usually say, I want to see you back in 3 months, or I want to see you back in 6 months to see the change in your hemoglobin A1C. So I hope that makes sense. But if there are questions about that, please put them in the chat or jot them down. Happy to answer that afterwards. I said a very short while ago that diabetes is something that can be reversed. So I'm going to start with how can I prevent and how can I manage my diabetes. So preventing diabetes starts with having very good habits with regards to the amount of sugar you're taking in and how active you are. So we always, and when I say we, medical professionals and nutritionists, nurses will always say, when you're eating food, you should be looking at foods that have a low glycemic index, whether you are diabetic or not. Foods that have a low glycemic index are foods that your body has to work to break down. Foods that your body can, foods that you ingest that your body can turn to sugar immediately are foods that should be avoided. And here's why. Soda. When you drink soda, it has a high content of glucose, but glucose that your body can access quickly, which means a lot of sugar is thrown into the bloodstream at one time. And your pancreas has to work very hard to bring that level down. When you have natural fruit juices or a fruit, your body has to break down the fibers in that fruit to access the sugar, which means the pancreas is working, but it's not working at a very high level. It's working at a constant level to decrease the sugar that enters the bloodstream. So that's how you can prevent diabetes, by what you eat. Eating foods that are complex carbohydrates. Those are wheat or whole grain breads, sweet potatoes instead of regular Idaho or russet potatoes, brown rice, millet, quinoa, any of those heartier grains. Those are carbohydrates, but they're complex. Beans have a carbohydrate content, but they also have a protein content. And fruits and vegetables, if you are trying to prevent diabetes. Now, once you are diabetes, when we talk about management, when you do have diabetes, when you are diabetic, you do have to be careful about the type of fruits and vegetables that you eat, because there are some fruits like pineapples, like bananas, that shoot your blood sugar up very, very fast. And you have to think about fruits that have a lower glycemic index that your body has to kind of break down more, which would be fibrous fruits like oranges, like grapes. And you have to be careful with the amount of those that you eat as well. But your diet should consist of brown rice, whole grains, lean proteins, and low glycemic index fruits and vegetables. You can also manage diabetes with medications. Most common medications are metformin and other oral medications. For people whose pancreas is really not working or their hemoglobin A1Cs are very high, these people need different formulations of insulins. With regards to diabetic management, the medical community has really advanced. We have continuous glucose monitoring so that you're not sticking your finger to check glucose, but wearing a device and it tells us what your glucose is in a 24-hour period. We have insulin pumps that provide small to high levels of insulin depending on what your blood glucose reading is at a certain time. But what I always recommend is starting with those building blocks and movement and exercise. Building muscle, lean muscle in your body decreases the risk of diabetes and will decrease your hemoglobin A1C. Doesn't mean that you have to go to the gym and start doing weight training and trying to lift 300-400 pounds. It means something as simple as walking 30 minutes a day, of doing movements, body movements and exercises with your own body weight, whether that's push-ups, squats, or just, simple exercises as, sitting down and standing up from a chair to build the quadriceps muscles. Those things really help to pull sugar out of the blood and decrease, one, your risk for diabetes, or two, your diabetic numbers. So it's 11:30. I want to be cognizant of the time, and I just want to stop here for any questions.
You can feel free to put those questions in the chat. You can raise your hand. You can just go ahead and unmute yourself if you'd like. Please feel free.
Okay, I have a question. Hi, I'm Wendy. I'm in Manhattan, but I'm really thankful to the Long Island folks and Dr. Guerrier. Your talk is wonderful so far. I'm newly diagnosed diabetic with a brother that has it and a sister that should have it, but is extremely rigorous with her what she eats and her exercise. I just started on the metformin, and I happened to talk to a cousin I hadn't spoken to in a long time, and she told me she was also just diagnosed, and she was also taking something called Restasis. Does that mean that the type of diabetes she has is more advanced? And what is Restasis? Or I think that's the name.
Oh, Dr. Guerrier, you're muted.
So basically, my question for you is, how long has she been diagnosed with, diabetes? But Restasis, from what I know about, is something for the eyes. Is there a different name?
Oh, maybe that's why I'm even thinking of it. I've had cataract surgery. I didn't have diabetes at the time I had that, but it begins with an R. Maybe I have the wrong name. I probably do. Sorry.
Oh, no. Okay, so I don't know which drug she's on, but what I will say is, depending on what her hemoglobin A1C is, that will determine her treatment.
Okay.
So for people who are newly diagnosed, we'd like to start with metformin because it's a drug we've used for a very long time. We have a lot of literature on it. And we know that it doesn't only affect the blood sugar, but it also prompts the pancreas to kind of create some, new beta cells and start working a little bit better. Depending on where she is, if her hemoglobin A1C is more toward the 8-9 range, we tend to use different drugs on that. But you bring up diabetes and cataracts and problems with the eyes. And yes, we do see diabetics that do come in with complaints of, I feel like there's sandiness in my eye, I have dry eyes, or I feel cloudy over my eyes. And those are some things that are the effects of diabetes. And we can use adjuvant therapy like Restasis, which is not a diabetic drug, to kind of help with those symptoms.
Okay, and I also happen to have fibromyalgia, and I'm arthritic. And before I got diabetes, I also already had some from my arthritis in my cervical spine. In my fingers, I have some numbness. If that's unrelated to the diabetes, can that be reversed, or that's a totally separate thing?
So if that is unrelated to the diabetes, it's a separate thing.
Okay.
That type of neuropathy. I often tell the story of my older brother who's a diabetic that has peripheral neuropathy, and it's not from the diabetes. It's from a medication that he had to take to control another condition.
Okay.
So even though his body, by diabetes is under control, that neuropathy is not getting better.
And one last thing, my youngest brother is a physician, and he told my sister, who should have diabetes, that it's really smart to exercise after a meal. And she said, well, sometimes after dinner, I'm tired. And he said, well, if you haven't exercised, during the day, get on that exercise bike. He just said, do it, how a brother can be. And so I hope you'll talk some more about how much exercise and when to exercise.
Absolutely, absolutely.
Okay, thank you very much.
Thank you very much for the question. So after dinner, or after breakfast, or after lunch, or whenever you can get out and exercise during the day, and at minimum 30 minutes of exercise. And it doesn't have to be rigorous exercise where you're breathless, but moderate exercise where your heart rate has increased 10 to 20 beats above your baseline, as long as that's safe for you to do, right? Meaning, when I say safe for you to do, I mean you don't have history of heart disease, angina, chest pain, or longstanding lung conditions. If you can sustain 10 to 15 beats above your minimum heart rate, right, or if your resting heart rate, that and sustain that is moderate exercise, 30 minutes a day. And it can be riding a stationary bike. It can be walking outside. The weather's beautiful, and there's so many benefits to walking outside. It can be a light jog if you're able to do that. It could also be lightweight training, 5-10 pound weights, isometric exercises, planks, yoga, anything that's going to bring that heart rate up, and at least 30 minutes. How many times a day? 3 times a day is a very good place to start, right? Depending on where you are on that journey, you can increase that number to 4 times a week, 5 times a week, but at least 3 times a week should be that minimum. So 30 times a day, rule of threes, at least 3 times a week, any time of the day, actually. So I have 2 questions in the chat. Thank you so much for that question, Ms. Wendy. First question is from Ms. Mildred Vega, who says, what about using artificial sweeteners? So the reason why we recommend using artificial sweeteners to diabetics is because these sweeteners will not spike their blood sugars, and they have a lower glycemic index. I will say this is my personal opinion. This is not the opinion of the medical community. There's some reticence to use artificial sweeteners because of, a lot of other chemicals that they have in them that are not so much studied and not regulated by the FDA. So there are a number of people that will, say stay away from artificial sweeteners because they can cause other dysfunction in the body. I personally opt for more natural, lower glycemic index sweeteners. So there are things like stevia, like agave, like monk fruit, that occur naturally in the environment, that are a lower glycemic index, that can be used as opposed to the sweetened lows and equals, which have just artificial chemicals. So while it's anyone's kind of what they'd like to do with regards to artificial sweeteners. You know, some doctors and dietitians will all absolutely say use artificial sweeteners because we know that it's not going to spike the glucose. But for me, I tend to be more natural, more holistic. I usually tell my patients to use stevia, monk fruit, or agave, which will give you the same sweetness, and the benefit of being a lower glycemic index food. So thank you for that question. Mr. Alan Bergman says, how long does it take to reverse a diabetic condition? Is it weeks, months, years? So great question. Thank you so much for that question, Alan. And it depends. It depends on these things. How motivated a person is to reverse this diabetic condition, and how sustained their efforts are, right? So I have seen in the patients that I've seen over the last 10 to 12 years, people who are very motivated can reverse their hemoglobin A1Cs in 6 months' time. We don't recommend it happen a lot faster than that because there can be other complications, right? It's kind of like someone with very, very high blood pressure. We don't drop them down to like normal because they start to have a lot of dizziness. So with diabetes, we say about 6 months. And in combination with weight loss, if they need to lose weight, medications, they need to take medications, diet, and exercise, I've seen hemoglobin A1Cs go from anywhere from 14 to 8 to 5 in 6 months' time. Now, the damage that's done by the diabetes, if caught early enough, usually can be reversed. But for people who have had long-standing diabetes that has not been very well controlled, even in decreasing that A1C, some of that damage is long-lasting. So we can stop the progression of the neuropathy, but the neuropathy that's there many times stays. The damage to the kidneys, I will say, I have seen it be reversed in folks who have not had a very, very long-standing history. And when I say long-standing history, I'm saying, 5 to 10 years or more of having diabetes that was not well controlled. So I hope that answers your question. And then the last question I see is, what is the total number of carbs that you can eat in one meal? This is different from everyone, but I'm going to give you the answer that I usually tell my patients who are at risk for diabetes or pre-diabetic. Less than 20 grams of carbohydrate in a day for folks who are diabetic or pre-diabetic is what I recommend. And so that means that we're splitting up 20 grams of carbohydrates in a day. So if you say, okay, let me allow myself 21 grams of carbohydrates, I eat 3 meals a day, you divide 21 by 3, 9 grams of carb, right? That's 27. My math is terrible, I'm sorry. 7 grams of carb in each meal. So how do I know how many grams of carbs are in my meal? So for most prepackaged foods, you'll see calories, the biggest thing. But then under it, you'll see carbohydrates, 3 grams of carbohydrate per serving, 4 grams of carbohydrate per serving. So I know if I eat this, if I drink this entire bottle of tea, green tea, I'm getting 4 grams of carb. So I have to subtract that from my 20 that I'm allowed it in a day. Now 20 is very strict. And these numbers, I usually like to refer patients to a dietitian because depending on how active you are and what your metabolic needs are, the numbers will change, but anywhere between 20 and 27 carbs in the entire day. Divide that into your meals. So you're saying, oh, that means I can only have half a slice of bread with breakfast. Okay, so what other things do you put on your plate to give you that satiated feeling? Lean proteins, right? And fruits and vegetables. So I'll stop there and hand it over to Brooke.
Thank you so much, Dr. Guerrier. So I know that you did mention walking as a great form of exercise for preventing and managing diabetes. We just have some tips for walking safely provided by the New York Coalition for Transportation Safety. So you should always use the sidewalk. That is a New York State law. And if there is no sidewalk, always walk facing traffic. See and be seen, wear brightly colored clothing, carry a flashlight when you're walking at night, and always try to make eye contact with drivers when you are walking. Make sure to cross streets at corners or crosswalks. That's a law as well. Don't text or talk on the phone while you're walking. It can be just as distracting as driving, using a cell phone, which is illegal, of course. And for more information, you can visit walksafeli.org, where there's plenty more information about those New York State laws and tips for walking safely. So I know that we did answer quite a few questions here. You can continue to put those questions in the chat, and if we have a few minutes at the end, we'll get to them. But we do have some final parting questions for you. So these are just some post-event poll questions just to gauge how you received today's program, and we would love to hear from you. And while you're answering those, I will just say we do have some upcoming events, some more installments of Talk with a Doc coming up. We have Alzheimer's disease and dementia on June 1st, heart disease and high blood pressure on June 15th, arthritis and osteoporosis on June 29th, and Breathe, all about asthma, bronchitis, and COPD on July 13th.
Hey, Mom, be safe.
Oh, thank you. And we do have 2 walks. The series is culminating in 2 in-person walking events. One is at Belmont Lake State Park, which will actually be led by Dr. Guerrier on Saturday, August 6th, and a walk at Jones Beach State Park on Saturday, August 13th. So thank you to everyone who's answering the poll questions. I see we've got 15 out of 20. That's great. I'll give it maybe 15 more seconds here, but thank you so much to Dr. Guerrier. Thank you to all of our attendees, and thank you to AARP for sponsoring this event. All righty, I'm going to close this poll out here. All right, once again, thank you so much for joining us. We hope you enjoyed today's program. Thank you again, Dr. Guerrier.
Any more questions?
Do you have time for any more questions, Dr. Guerrier? I know we have a few more in the chat here, but if not, I totally understand. It's 11:46. Oh, I can't hear you. I'm sorry.
Let's see. I think I can take 1 or 2 questions, and then I have a meeting that I have to hop on. Okay, so let me see. I'll just scroll back to the chart. So there's a question about fats and so apps. I don't know of many apps for diabetes. I do apologize for that. I like to use a fitness app, and the fitness app to kind of track my movement, and that's what I recommend for folks. With regards to fats, there's good fats, bad fats, right? Bad fats are the fats that you get from fried foods, oils, unhydrogenated oils, butters, so on and so forth. Those increase the cholesterol in your body. Foods that help your body create HDL, which is a good cholesterol, which decreases the overall cholesterol, are oils like olive oil, fish oil, avocado. Those are good fats. And so those are the things, if you're going to have those fats in your diet, those are actually more helpful to you. But we do absolutely recommend, being careful with unsaturated fats that you get from fried foods, being careful with fried foods. It's a question about being on Ozempic and if Ozempic can cause pancreatitis. It can cause pancreatitis, which is why we we monitor certain blood levels, and it's a low incidence of pancreatitis in folks, but it is a side effect that we do monitor for. So what can be done to lower A1C after being on Ozempic? I would say we should be thinking about movement, weight training, meaning weight training to build lean muscle in the body, whether that's lean muscle in the quadriceps, in the abdominal area, and in the back. That can help kind of get you over that hump back down into the 5.7 range, as long as your glucose has been controlled. And you may want to consider talking to your doctor about continuous glucose monitoring to see if you are having episodes where your blood glucose is a little bit higher. Okay. Vitamins that lower A1C, I cannot say that I recommend any specific vitamin to lower the A1C. I think what we spoke about before are the kind of tried and true ways that will help to lower A1C. Question about why sugar is higher in the morning than the rest of the day. So that could be attributed to something that you're eating at night. And I don't know if you're on insulin or not. If you are on insulin, there's something called the Somogy effect. And what happens is the insulin in the body brings your blood sugar levels down a little bit too low. And then your body produces cortisol and increases the blood sugar to combat that insulin level. So I don't know what medication regimen you're on, but if you are on insulin and you are seeing that your blood sugars in the morning are very high, please talk to your doctor and bring up that concern, because it could be that the insulin that you're taking is a little bit too high at night and you need to move that dose. Or it could also mean that you're eating something at night that's causing your body to spike your blood sugars up in the morning. So I think those were all the questions in the chat. I just want to say thank you to everyone that participated. Thank you to AARP, to the Long Island Health Collaborative. It's great to see everyone, and have a great day.
Thank you, Dr. Guerrier. Thank you again. All right. Thank you, everyone. Have a wonderful day.